Hi, I'm Amber with Critical Movement YYC, and this is a video on a couple of things to consider in terms of shoulder health. Okay, so there's two things that I tend to focus on when I'm looking at shoulder injuries, shoulder pain. So one of them is how your scapula move, how your shoulder blades move, okay? We want shoulder blades to have that movement, that gliding to them. They should go forward, they should glide back, they should glide up, they should glide down. Tendency is they get stuck around here, and then when we try and move them, they go dunk, 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 and it's really hard to get them to move and glide slowly. So one great exercise in order to play with that gliding movement is a half plank, right? That modified plank position where you can be here on your forearms, and if this is where you're working on weight bearing, this is where you're working on weight bearing. Notice where my pelvis is. I'm holding my torso in one position, okay? Now what I want to do to play with my shoulders is sink down and press and round up. Sink down and press and round up, okay? So you can play with that position. Realistically, you can also do this in a door frame. If you're holding onto the door frame, you can pull the shoulder blades apart this way and sink them back this way. Notice that my body's remaining relatively still. I'm not doing this to this to this, okay? I'm just trying to isolate the shoulder blade movement. Now, the second thing that has to do with shoulder blade health is the alignment of our upper back. Now, I say the words alignment, we all of a sudden think to that posture where we have to be super straight and we pull our shoulders back and we pull our jaw back. That is too much work. If you've worked with me before, I've said it before, we're looking for our positioning, okay? That wiggly space that's fairly relaxed where we feel stacked and stable. Alignment and posture have so much negative connection with them in the last 15 years, where we get to the point where we go to a chiro or physiotherapist and they start measuring the angles of how much we're off, and that just freaks everybody out. You know what? We're all asymmetrical. One shoulder, you can probably tell on me, one shoulder's higher than the other shoulder. That's normal, okay? Studies have shown that that asymmetry is not pain-causing or pain-inducing, okay? That doesn't cause injuries. There are other reasons for that. One is lack of movement. We need to move in our lives to keep our joints healthy. So, try this. I want you to sit and you're going to get to slouch. We all know how to slouch. 15 minutes a day of slouching, totally fine. Don't freak out. Slouching is fine. 15 minutes a day. Don't do it for 8 hours. It's the lack of movement that gets us, okay? So what we do is I slouch, okay? Here I am slouching. You can see how my shoulder changed position. If I go back to where my positioning is, and I'm not forcing things, I'm just moving into this positioning, the shoulder falls differently. I do this, the shoulder falls forward. Here's how it works. If I go to reach my arm up and I'm in this position and I reach my arm up, I can get to here and I actually feel a little pinch in my shoulder, okay? It's not the best movement pattern for your shoulder joint. Now, if I come back to my positioning and I move my arm, I can move it in a full circle with zero pinching. So the alignment of your thoracic spine, which is your upper back, has to do with the movement capabilities of your shoulder, which can lead to pain. Because if you're here and you have a tendency to be here for the most part, and you go to reach up, it's going to pinch. You keep doing that, there's going to be more pinching. What do we want to do? We want to release that. Find our positioning. Okay, you can do that with critical alignment yoga therapy, which is what I usually really start with for shoulder injuries. Okay, because it addresses both of those things that I just talked about right off the bat, and all you have to be able to do is lay down and breathe for that. So, any questions, comments, please feel free to leave them in the chat below. And I'm looking forward to seeing you next time.